Lisa, help me a little bit in the background with this.
Wow, there were a lot of red flags in this case. So let me go through the history for you just a little bit, Dr. Drew, because there were a lot of problems with Encore Plastic Surgery. First of all, they specialize in procedures like tummy tucks, Brazilian butt lifts, and something called the mommy makeover, which is billed as a, quote, mixture of plastic surgeries. Now, according to the Miami Herald, a physician linked to Encore is accused of severely injuring 4 patients during liposuction and Brazilian butt lift procedures in May of 2015. Now, the Miami Herald says that the female victims range in age from 29 to 35, and each was hospitalized anywhere from 3 days to 3 months. Florida state health officials were so concerned they partially restricted this doctor's license. But now we're learning that he reportedly botched yet another surgery. A woman is alleging she went to him for a Brazilian butt lift, but get this. Instead, he gave her a tummy tuck instead. She says her surgery went so horribly wrong that she was in the hospital for 11 days with kidney failure, and the doctor in question has been a licensed physician in Florida since 2000, but he is not board certified in plastic surgery, Dr. Drew.
Well, speaking, Lisa, of Botched, on the phone I have Terry Dubrow, board certified plastic surgeon. He is featured on E's Botched. He's the author of Dr. and Mrs. Guinea Pig, present the only guide you'll ever need to the best anti-aging treatment. Terry, what are we going to do? Hey, well, thanks for welcome to the program. I really appreciate you being here. A couple things. Aside from the fact that these guys are outliers, don't we need to really remind people that plastic surgery is a surgery? There's anesthesia, there's risk every time you go into the knife?
It's really true, Dr. Drew. One of the most common misconceptions about plastic surgery is that it's like having a nip and tuck. It's no big deal having a little work done. In fact, it's as serious as cardiac surgery or cancer surgery, and it has all of the same risks and complications associated with it.
I love that you said it and said it that way, because in proper hands, you can anticipate little or no trouble, much the way you can with other important medical surgical procedures. How does a patient select the right surgeon?
You know, all of these complications, in a way, can be avoided by asking the doctor one simple question, and that is, doctor, are you allowed to do this procedure in a hospital? Because if the answer is yes, that means they are board certified in plastic surgery. They have been vetted by the hospital for any malpractice issues, and they're well trained to do it. Despite that, as you understand, you can still have complications associated with plastic surgery, but this clinic in particular has gynecologists, OBGYNs. They don't really have any board-certified plastic surgery, which basically means these doctors took weekend courses in plastic surgery and the next Monday following that course called themselves plastic surgeons.
Yeah, I don't think the public understands that I could go do plastic surgery if I was, unscrupulous, but I would never dream of it. Leo, any problems from a legal standpoint on your front?
Yeah, I'm waiting to hear anything about where's the district attorney, where's the criminal, forget about the civil lawsuits, forget about losing their license. Why haven't the board, the medical board, work with the district attorney's office and bring some of these bad doctors to justice? Is the board in bed with these doctors? And
no.
Well, then what's happening? Where's the criminal investigation?
I believe at least there is a criminal investigation underway, right? But listen, Leo, there's a gigantic distance between malpractice and people not keeping standards up to where they should be and actually engage in criminal negligence.
I can understand criminal negligence, but here is a situation where there is an absence of government involvement, and you're basically allowing the board and the medical profession to police itself. It's not doing a good job.